watching Local 10, home of Local10.com. WPLG Local 10 News at 11 starts now.
When it comes to finding a job or meeting that special someone, you've probably heard the saying that timing is everything. Well, now a new study shows that it's also true when it comes to taking certain medications. Local 10's Kristi Kreuger explains how taking your blood pressure medication at night could save your life.
Hi, Zelda. How are you?
It's important for 74-year-old Zelda Broslowski to get her blood pressure checked often. The first time she saw Dr. Ackermann, Zelda's blood pressure was dangerously high, and she didn't even know it.
It's called a silent killer for a reason, and most of the times you have no symptoms until you do, and that symptom could be a stroke.
Obesity, a lack of exercise, stress, and family history are all risk factors.
When you have a hard situation in the family, on both sides of the family, I thought that I better do something positive here.
Zelda's first positive step to take her prescribed medication to lower her blood pressure. The next step to take those pills at night. Despite all these effective medications, Dr. Ackermann says many of his patients were waking up with out-of-control numbers.
So I started asking him to either take one or all the medications and switching them at night to see what the effect was. And in fact, they were starting to wake up with much better blood pressure levels and noticing that their control was a lot better.
And now a new study backs up those findings. The study looked at 600 patients over a 5.5-year period taking all kinds of different blood pressure medications. And what it found is those who took their pills at night had a 30% lower risk of having either a heart attack or a stroke.
Before we have evidence that, yeah, it's effective, we can control your blood pressure better. But now we have evidence that says it's not only better, but it actually protects you from having strokes and heart attacks.
And that's proof enough for Zelda, who says she has a lot more living to do.
So I'm busy all the time. I bake, I cook, you name it, I do it, and I like it all.
Kristi Kreuger, Local 10 News.
And this study is very important because 1 out of every 3 adults in the U.S. has high blood pressure, and the risk of having a resulting heart attack or stroke is higher in the early morning hours.